Namo Namaha. While certain breathing practices, pranayama, breathworks offer various benefits, it is claimed that it reduces your anxiety, depression, sadness, stress, so many things. But certainly, there are certain limitations, certain precautions, cautions to take care. If you take care, you will grow. First is over rebreathing. If you breathe more deeply or frequently than needed, it will lead to lightheadedness or dizziness, because due to excessive CO2 removal causes blood vessels to constrict and further decreasing blood flow to the brain. So it can cause dis-ease or uneasiness in your being, anxiety or panics. The rapid breathing triggers the fight or flight response, mimicking anxiety symptoms. So you should take care while doing rapid inhalations, exhalations. Tingling or numbness. Due to changes of the blood flow and pH levels in the body, these sensations happen. Let's understand the scientific reasons behind these experiences. Our bodies have natural mechanism to regulate breathing based on oxygen and CO2 levels. The rapid breathing associated with over rebreathing activates the sympathetic nervous system, and this response is related to the fight or flight response. So what's the solution? Solution is to practice under a guidance. Seek instructions from a qualified yoga teacher or healthcare professional, especially a yoga therapist, to ensure proper technique. You don't know how much frequency, how much depth, how much speed to adapt in the beginning. So initially, you should take care and get a guidance. Take care to start slow and listen to your body. Begin with short sessions and gradually increase durations and intensity as you adapt. Pay attention to symptoms. If you experience any discomfort, stop immediately and consult a yoga therapist, healthcare professional. Another problem that we adhere during the practice of pranayama generally is forced exhalations. Techniques like Kapalabhati, that is bellows breath, involve forceful exhalations, which can cause rib injuries. Yes, you heard it right. People get injured, especially if done with improper technique or conditions with increased abdominal pressure. It can exaggerate issues like hiatal hernia. Another condition that exists while the practice of pranayama is dizziness or lightheadedness. Similar to over rebreathing due to CO2 depletion, it happens, we start feeling dizzy. Let's understand the scientific reasons behind it. The forceful exhalations creates high pressure in the chest and abdomen, which can strain muscles and ligaments. Rapid expulsions of air can lead to CO2 depletion, affecting blood flow and brain function. So what's the solution now? Let's understand the solutions of these problems. Avoid forceful exhalations. Focus on smooth, controlled breathing instead. Modify the technique. Use gentle exhalations or diaphragmatic breathing instead. You can utilize deep yogic breathing in the place of forceful exhalations. And again, consult a healthcare professional yoga therapist if you have any concern about health or pre-existing conditions. Another problem people face during the practice of pranayama breathwork is breath holding. Practices like Bhastrika involves breath holding, which can cause increased blood pressure. Due to the strain on the heart and the lungs, this can lead to lethal conditions, discomfort, and various problems. It can also lead to fainting because decreased oxygen flow to the brain can alter our brain functions and we can get fainted. So let's talk about the scientific reasons. Holding your breath reduces oxygen intake and increases CO2 levels, putting stress on the body's systems. The strain on the lungs and the heart can lead to temporary spikes in blood pressure. You should take care while practicing breath holds. What's the solution? Avoid prolonged breath holdings, especially if you have any cardiovascular or respiratory conditions. Do not hold your breath in Bhastrika or any other Kumbhaka for a longer duration of time. Graduate slowly. Start with short holds and gradually increase duration with practice and guidance. Shanahi shanahi uparameda. Grow gradually and slowly. And the most important thing is to listen to your body. If you experience any discomfort, immediately release the breath. And remember, breathing techniques should be approached with cautions and under proper guidance. Guru Padishta Margena Yogam Eva Samabhyashet Ekante Matika Madhye Sthatavyam Hatha Yogina. There should be proper conditions and proper guidance. And you should know the individual needs and limitations because these vary. Consult a guru, teacher, professional before starting any new breathing practice, especially if you have any pre-existing conditions. Focus on mindful, controlled breathing rather than pushing your limits, trying to be a supernatural being. By understanding the potential risk and practicing safely, you can harness the power of breathwork, pranayama, for improved well-being without compromising your health. And in Shastra like Hatha Yoga Pradipika, it has been mentioned that if you practice the pranayama in wrong way, forget about benefits, you will get diseased discomforts. Hikka kasa swasasascha shiro karanakshi vedanaha bhavanti vividha rogaha. So many disorders appear if you practice it in the wrong way. And if you practice in the right way, you will attract all the benefits mentioned in Shastras and found in literature, contemporary scientific worlds. I hope you found this video interesting. Keep sharing, keep loving. Namaste.